Hi, Medical Wildcats. I'm Joseph Guggenheim. I'm a 1972 alum of the medical school, and this month's presentation is on Dr. Rebecca Lee Crumpler, who was the first Black woman physician in the United States. I've chosen this topic this month because March is Women's History Month. Dr. Crumpler was the first Black woman physician in the United States. Strangely, there are no known photographs of Dr. Crumpler. Sometimes we see these three likenesses. The first one on the left is probably the most commonly seen one. And then there's the one in the middle. And then the third one is a metal medallion. The first one, though, is probably really Mary Eliza Mahoney, who was the first Black licensed nurse in the United States. The medallion is a medal produced by the Sun Oil Company for an award ceremony. We do not know how the sculptor chose this image. And the one in the middle, nobody really knows who this was, but there are no known documented pictures of Dr. Crumpler. She was the first Black woman to earn a medical degree in the United States and the first Black woman to publish a medical book in the United States, and one of the first Black physicians to publish any medical book in the United States. She was born in Delaware in 1831. Her aunt inspired her to go into medicine because she admired the way that her aunt relieved the suffering of others. This was a kindly aunt in Pennsylvania that she admired. Dr. Crumpler then worked as a nurse for 8 years, beginning at age 21. She married Wyatt Lee in 1852 in Charlestown, Massachusetts, which is a suburb of Boston. After 8 years, one of the physicians with whom she worked suggested she go to medical school. So she entered the New England Female Medical College, the first medical school for female doctors in the United States. She was the only Black woman in her class. The New England Female Medical College originally trained women for medical midwifery. At the time, it was believed that it was not appropriate for men to practice obstetrics, so all midwives were women. An abolitionist, James Wade, paid for her tuition. In 1864, she was awarded a Doctoress of Medicine degree. And at the time, there were just over 54,000 physicians in the United States. 270 of these, or less than 0.5%, were women, and they were all white. There were 180 Black male physicians in the United States, but there were no Black women physicians. New England Female Medical College closed in 1873 without ever conferring another degree on a Black woman and no more Doctoress of Medicine degrees. The school later merged with Boston University. As a matter of comparison, Chicago Medical College, which was the predecessor of Northwestern, admitted 3 white women in 1869. Only one was allowed to graduate, and Northwestern did not admit another woman until 1926. Dr. Crumpler began her medical career in Boston, primarily caring for poor African-American women and children. Her first husband died, probably of pneumonia, so in 1865 she married Arthur Crumpler, a former enslaved person. They moved to Richmond, Virginia, where she began to work for the Freedmen's Bureau, a bureau set up after the end of the Civil War by Congress to provide medical care to over 30,000 formerly enslaved persons whom the white people refused to see. Throughout her career, Dr. Crumpler encountered resistance. Pharmacists would refuse to fill her prescriptions. She was denied admitting privileges at hospitals. And some opponents said that the abbreviation MD stood for mule driver. Dr. Crumpler and her husband moved back to Boston in 1869 to an area known as the North Slope on Beacon Hill. Her home at 67 Joy Street still stands, and there's a plaque to commemorate her accomplishments. From her house, Dr. Crumpler treated women and children regardless of their ability to pay. The Boston Globe described her as a very pleasant and intellectual woman. She published one of the first books by a Black physician in the United States, the title, A Book of Medical Discourses, in 2 parts. It contained medical advice, but also included commentary on political, social, and moral issues. The first section was dedicated to the care of infants, and the second section was on the stages of development of women and the common diseases of women and children. These are some of the quotes from her book. Children should not be asked if they like such and such things to eat, with the privilege of choosing that which will give them no nourishment to the blood. Children who are dosed during infancy to every supposed illness are seldom robust. Sleep producers serve only to bind the bowels and stupefy the senses. Parents should hold on to their children, and children should stand by their parents until the last strand of the silken cord is broken. A cheerful home with a small tract of land in the country with wholesome food and water is worth more to preserve health and life than a house in a crowded city with luxuries and 20 rooms. Thousands of little ones die annually at our very doors from diseases that could have been prevented or treated by timely aid. People do not wish to feel that death ensues through neglect on their part, so they speak of consumption, cholera infantum, diphtheria, etc., as if sent by God to destroy our infants. She was not aware of the germ theory at the time, so she did not know the cause of some of the diseases, but she was interested in the cause of cholera infantum, which was called summer diarrhea, a disease that killed many babies every year due to dehydration. Many attributed this disease to contaminated water or spoiled milk. Dr. Crumpler thought it was something in the air, probably bacteria as we know now, but she did not know about the invisible microbes, but warned that the disease was due to atmospherical phenomenon. Dr. Crumpler's legacy has been lost until recently, but now there have been several books published about her. The first two on the left are aimed at children, especially girls, to encourage them to go into medicine. And the one on the right by Hillary and Chelsea Clinton is a collection of stories about women and their accomplishments. Dr. Crumpler was buried in an unmarked grave, and its site was unknown until about 2020. It was found, and she was buried next to her husband, Arthur Crumpler, at the Fairview Cemetery in Boston. So let's get together again next month virtually. In the meantime, stay healthy, stay connected with each other, and I look forward to our virtual meeting again next month.